Thank you guys for being here. I'm Dr. Barzinski. This is Dr. Wilcox. Today we're just going to go over medical treatment of dogs, how to save the most dogs you can with limited funding. First, just a quick thing I want to hit on. Make sure that what you're doing is legal in your state. Different states have different requirements. This is a good book. It might be a little bit outdated, but it goes over a lot of legality things as far as shelter medicine. Rabies testing, for the most part, you're not going to have patients with rabies, and a lot of people really freak out about neurological animals. But, you know, if you do think that, or if your vet really does think that an animal has rabies based on clinical symptoms, the fact that they bit somebody, make sure you do the proper legal things as far as that goes, because that's very important. So, going over the basics, intake, all dogs right immediately on intake should get a vaccine. We really don't have any rules as far as dogs that shouldn't be vaccinated. We just say everybody needs to be vaccinated, no questions. Distemper vaccine, parvo vaccine, bordetella. Rabies is not as important immediately, but if they're old enough and you can do it on intake, it's best to just do that. Dewormers, Strongid, that will kill most of the worms that these puppies have, and it's just one dose. You want to microchip them to make sure that they're part of your organization. If they get lost, somebody can scan them and track them back. And if they're 6 months or older, we actually do it at 7 months, because if they're less than 6 months, the heartworm test really isn't valid. So we like to say about 7 months we'll test them for heartworms. Ivermectin, we give them as a heartworm prevention. It's very cheap. You can get it at the feed store. So as far as wellness goes, after the intake, you want to get them on a vaccination schedule to make sure they're going to be completely vaccinated. We do vaccines every 2 weeks up until they're 4 months of age if they're in the shelter, and as well as in foster. Adults, if they're over 6 months of age, you know, they get 2 vaccines and they're considered good. We will deworm as the puppies. They'll get dewormed when they get vaccines. And again, when they're in the system, they should get flea prevention every 30 days.
One thing I just wanted to throw in at the base of this intake slide, we don't see a ton of worms in Tucson, Arizona, where Pima Animal Care is located, but we see tons and tons of ticks, some of which carry zoonotic disease. So we're all about looking for ectoparasites. Definitely don't forget your dewormers, though.
Okay, I went over that. And so no-kill treatment is different in the sense that, you know, we have limited funding. We're trying to save a bunch of animals on a decreased budget. So we basically spend what the average pet owner would spend on an animal, get their quality of life good, and this is done through protocols. You know, all treatments are the same across the board, so everybody knows what's going on. That way we can get them out quicker, getting them out to foster, adopters, and we treat everything like they have the potential to live.
There are many, many cases when you're still going to need to perform humane euthanasia, though Austin Pets Alive pulls from most municipal shelters locally. Our shelter is a giant open admission facility, so we very often have to do the humane thing. But there are benchmarks, so we see tons of trauma. But we let those animals go when they have a really poor prognosis. So they're walking in, or not walking in, they're being carried in. They've got the white gums, they're terribly in shock. We have animal side glucometers and lactometers, so we can get a prognostic indication of how bad off are they, how many hours have they been roadside. So we see tons of trauma coming in that way. We also have a lot of animals that come in that are severely ill, and either they're strays or their owners waited too long. And though we are very aggressive and very successful in treating a lot of these, there are, again, indications when we shouldn't be spending our resources on animals that are too far gone. Chronic conditions, well, if we can manage the pain, we'll talk a little bit later about our hospice programs, but there are some chronic conditions that you just have to let the animal go because it's the more humane option, and you have to be able to defend that. But we have lots of ways to do diagnostics to determine who can go up for adoption, go into hospice, versus who needs to be let go. And then the last thing that no-kill shelters, the last area that we all struggle with is the dogs that are just too unpredictable to put back and into the community. We do have a lot of rescue groups that step up for our worst cases. We do have a behavior team, which is great because we didn't have that a few years ago. But as veterinarians, one of the things that we focus on is making sure that we give those animals medications that control anxiety. And if we can control anxiety and make these animals be able to interact in a normal way and have a good quality of life, then we have saved their lives. So behavior still should have a medical component. We were talking, both Alexis and I, sedate, very aggressive dogs to look for some source of pain. So making sure you don't find a tooth root abscess or horrific arthritis in the hips, some reason for these animals to be unpredictable and potentially aggressive.
Yeah, we'll do spinal radiographs sometimes. Sometimes, you know, the counselors report that whenever they go to pet them on their back or may push them down to sit, they get aggressive. And so, you know, we'll make sure there isn't any spinal trauma or arthritis back there that's causing pain, that kind of thing. Because we want to give them every chance they can get. Also with the behavior team, I don't know, how many of you guys have a behaviorist or behavior team? That's awesome. That is huge because they know the behavior side, we know the medical side. We can get together, talk about, do you have reasons this dog should be aggressive? Do I know? You know, we've done therapy with them, rehab, all that kind of thing, and nothing's working. You know, and those are the cases that unfortunately you have to let go. So how do you get all this done, set your priorities, triage? So us, we like to pull the problems we can treat. So the acute things that, you know, just happened, trauma, wounds, fractures, short-term diseases that might need just 2 to 4 weeks of antibiotic or pain medication. And time is huge. Time, you know, is your ally. Most things with time get better, even despite what we do. And you know, these guys, you get them in, you put a splint, you send them to foster, you know, so they don't even have to be in your hospital, in your shelter, if you can get them out. Also the chronic problems, the older dogs with arthritis that may just need pain medication and joint supplements, and get them out to foster or get them adopted. So, you know, you just want to keep their quality of life. We do this also if there are really expensive procedures that we need to be doing as far as to keep their quality good. We'll raise chip-ins, and we'll go over this a little bit later.
So by contrast, in Tucson at Pima Animal Care Center, as an open admission facility, we see it all, and most places actually send us a lot of other limited admission shelters in the area send us the animals that require medical care. So we're even infused with more of the community medical aspect. So these are actually 2 overlaid graphs. The bottom dots and dashes are monthly, actually, cases of new upper respiratory disease. So for those of you that work in a shelter, you know that like kennel cough and respiratory disease are the bread and butter of what you do every day. Everybody catches it if they're there long enough. So on average, we're diagnosing about 3 to 5 new cases of kennel cough a day. But on top of that, you can see we're diagnosing and treating at least that many cases, and sometimes 3 times as many cases of major medical issues. So kennel cough is the easy stuff now, and now we're spending a ton of our time dealing with trauma cases, fixing up animals with dental disease, getting allergic animals under control, and turning around geriatric animals, fixing them up to get them up for adoption. So this is a huge investment that we've decided as a medical team that we're gonna take on, and as a result, we have a really diverse set of an adoptable population. But you still gotta do the upper respiratory disease, by the way.
So triaging these things, it's important to be flexible with your drug choices. There's usually a cheaper option. You know, a lot of private practitioner vets, they'll want to go with the gold standard, the most expensive thing. You don't have to go with that. So, you know, things, antiemetics for vomiting, Cerenia is really expensive, Reglan isn't. So if you can go with Reglan, you know, that's better than nothing. And Reglan works well too. So I touched on protocols. Protocols are huge as well, so everybody's on the same page. Protocols so that the vet doesn't have to see every single animal. We have protocols for upper respiratory infection, diarrhea, that the technicians can follow up until a certain point, until they become like a chronic issue, and then a vet steps in. And this is just to help with time. The only conditions that we actually will spend a lot of money on, so we'll elevate these guys, are the ones who are going to have lifelong pain because of it. So say an animal with fractures in both hind legs. You know, the chance of them both healing great to where they're not going to be in pain is probably slim, so we'll actually raise the money to help fix those.
So one thing I have recently discovered among our colleagues that are at facilities that want to go quote unquote no-kill, and I'm super happy with the number of institutions that are making that internal change. But one thing I really want to encourage you is to empower your vets to do quality work. Because remember, we're here to save, but we shouldn't be sustaining animals that can't be humanely maintained. So make sure that it's not expensive to have an in-house blood machine, but without one, your veterinarians really don't know what's going on, especially if you're going to be called to court. So we see a lot of potential cruelty neglect cases, and we see a lot of geriatric animals and a lot of roadside hit by cars that we need to know what the blood work is saying so that we can devise the most appropriate medical course. So please make sure if you have a medical program that doesn't have this basic stuff, that you figure out some way for a donor to get that in place for you. Because it's an expensive initial setup, and monthly it can go, if you have students at all, vet students, they go crazy with the blood work, but you really do need to have some very basic diagnostic capabilities. And
this helps save you money in the long run because a lot of people send out blood for blood work. You can actually raise the money for the cartridges used in these machines. They could be like $20 for, a blood panel. And if you need to run it, you could ask the foster to help pay for it, that kind of thing if needed. So it helps because you can get the results immediately. And you're not going to use it on everybody, but for the ones that you need it, it really helps out. So the way we save money, we don't do a lot of testing. So for distemper, we go by symptoms. We don't test. A lot of other respiratory disease, a lot of people will do respiratory panels, see exactly what's going on. We basically just treat for the number one causes of the disease. And, if it resolves, then, we continue treatment, or we change it up if it's not. Because if you're going to get a negative result, but they still have all these symptoms, you're still going to treat the symptoms. So you're doing the same thing either way.
So, and one thing that we have offered, because we get discounts for the diagnostics that we do run, sometimes rescue is unwilling to step forward for a potential medical animal unless we do some testing and they know what they're getting into. So we will throw that out there. If it's a test that seems otherwise a little crazy, but somebody's willing to take the animal depending on it, then we'll run that more expensive test for them to get the animal out of the shelter.
And the James Herriot medicine, I don't know if you guys have read his books, they're awesome. But basically, like I said before, a lot of things heal with time, and so nature is your biggest ally. Use what you have. Sometimes it's like a MASH unit. You know, you got a box and you just have to pull out what you can use and what's gonna work. Depending on your funding, you know, buy the drugs that you can afford. So there's always a cheaper option. And if you really need that expensive drug, you know, start a chip-in, ask fosters, you know, market the animal saying, you know, it's gonna cost this much money to do A, B, and C with, you know, Harry the dog, whatever. And you'll probably get it.
So other ways to save money. We are recipients of lots of gifts from hospitals and other clinics. We have tons of tarps donated, tons of ear cleaners, but we also get lots of drugs. And this is something that's going to be really case by case for you all. In the state of Arizona, they do not consider animals within municipal shelters to be under their purview. So even though I have a state-issued premise license, I can use expired and donated drugs on shelter animals with some exceptions. So that means that I have a huge pharmacy of things, many of which are super expensive meds that are all donated from other vet clinics or sometimes the public. You do have to make a call. If it's insulin, we're probably not going to accept it. And if it's controlled drugs, we can't touch it. But there's lots and lots and lots of other drugs that AHA certified clinics have to throw out if they expire on their shelves, even though the studies have shown that these drugs are perfectly good for decades past their expiration dates. So check your local rules and see if that's something that you can legally use in your practice. And don't let your vets try to tell you that it may not be safe because I've done it for 10 years and I haven't had any problems. That said, there's going to be lots of things that you do have to buy. Even though these notes are kind of wonky, having extra bodies everywhere is super important. Volunteers, fosters, they sort and maintain all the drugs that we get donated. When we do have to buy expensive stuff, like the tick meds are super expensive, some of the eye meds are stupid expensive. We'll use one tube on multiple animals, or we'll get out a razor blade and we'll cut those expensive tablets in halves or quarters or sixteenths, whatever we need to do, because those drugs work great. That's why they're so expensive and still on patent. So don't be afraid to do that. And then always look for alternatives to the expensive stuff. You may not be able to order, we're like on contracts for everything, so some of our products skyrocket in price throughout the year, but we have a nonprofit that can buy drugs more cheaply through compounders or through other contracts. So always be ready to ditch a drug if it gets too expensive and be ready to think of something else that you can use instead. Lastly, we have an awesome Amazon wish list that gets us a ton of nutraceuticals that are super helpful. So if you manage animals with arthritis, obviously you should be having them on some kind of joint supplement. We have tons of wounds that we put Manuka honey in, and it's kind of stupid expensive, but people love to buy honey for you. So we actually have to put a cap on the number of bottles people can buy. Cast padding, we fix up tons of broken legs, fish oil. All of those things can be spared your budget costs by asking someone else to buy and have them directly delivered.
And the things that you want to be proactive on and treat ASAP. Painful conditions, I mean, first thing you want to get on board is pain medication before anything else. And other conditions, eyes are really important. You know, we want to save sight if there's a chance. So if they're showing conjunctivitis, their eyes are sealed shut with discharge, you're going to want to start treatment on them right away. You know, you might start 3 times a day, 4 times a day until the eyes open, and then you can go down to twice. Neonatal illness, so anything, you know, under like 8 weeks of age, anything super tiny, under 5 pounds, if they're not eating, if they're vomiting up all their food, they're going to die pretty quickly from hypoglycemia. So if you have a little one that's you're treating, it's not going well, or even they're losing weight despite force feeding and whatnot, we actually will escalate them really quick to Baytril, which is the strongest antibiotic we really have, just because they will go downhill so quickly. So we'll start sub-Q Baytril on any tiny little puppy that's just, skinny, not thriving. We might not know what's going on, but if it's some kind of systemic infection, hopefully it'll get them back on track. Punctures, punctures when treated with antibiotics heal up great. If you don't, they could form an abscess, so you want to be proactive in getting them on an antibiotic for that. So we have two options as far as our funds, and basically as a no-kill shelter, what we're going to do is spread all the funds, over the most animals that we can versus just a few. So we're going to go over a few things here, conditions that we do that with and how we do it.
So if you're going to jump in, it's going to be costly, but here are some ways to save you some money. If you are deciding that you're going to start treating trauma, you're going to need to be aggressive about it. It's actually not that expensive to treat, but you have to do it in a timely way. So if an animal comes in shock, you have to be able to place an intravenous catheter, get some hypertonic saline or some other blood sugar or blood pressure support, fluid support, especially if they're bleeding. And that means you're going to have to plan for extra expenses, especially in that first few hours. Like this is when the animal's going to decide if it's going to live or not based on your treatment, right? So you got to get pretty aggressive. The next thing is, if all you have is Rimadyl, that's probably not going to be appropriate for you to start treating major medical. However, if you feel comfortable handling opioids in your clinic, and we handle buckets of them, we're super careful, but we save tons of money and we provide excellent analgesia, pain control. So it's super cheap. Hydro has a very high abuse potential, but that doesn't mean that you shouldn't give it to animals because they don't get addicted, right? So for $3 a day, you can treat a big pit bull and really, really control the pain of major fractures. If you have, in our case, we have less staff and more money, we'll spend the money on a fentanyl patch, and that will provide 3 days of solid pain relief for the worst hit by car cases. Buprenorphine SR is a sustained release of buprenorphine. It's great for puppies, doesn't wallop them as hard as some of the more potent drugs, and for cats, it's awesome too. But for an average puppy, it's only $3 to treat for 3 full days. So awesome. That said, you should always be adding multimodal pain management. So your opioids are up here for the big pain. And then as soon as animals are not vomiting or they're able to eat or drink, you should be adding in your Rimadyl, your carprofen, your Medicam, those sorts of things. And then gabapentin is dirt cheap. So both of those drugs should always be in your pharmacy because those will get you out through the more chronic stages of the pain. One other thing, if you are thinking about taking on some of these major hit by cars, you're going to have to worry about bladders, which may be something you're not used to. So be careful and make sure that your veterinarian has the materials that they need to make it easy to manage those bladders until an animal can figure out whether or not they're going to be able to urinate on their own. So that in and of itself can be life-threatening. You get them through the shock, and then they'll die of a ruptured bladder. So there are a couple of things you have to have in place, but they're not expensive. So another plug I'm going to make is if you're going to do major medical and or cruelty cases, you're going to need an x-ray. And you don't have to have the most awesome digital x-ray on earth, the $100,000 model. You just need something that will give you a yes or no on the break or a yes or no on the chest full of tumors. That's the level of things that you need. Very often when we send things to specialists, they don't like our x-rays. They're just not high enough quality, but they do just fine for us. So please, if you haven't got one and you want to ramp up to do no-kill medical, this is a major expense you're going to need to get in place.
And at APA, we've had old horse, large animal unit that we basically hang from the ceiling. And we've used that for, I don't know, almost 10 years now. We are going to get an upgrade soon, but we've done well with it, and that you could find them used for not too expensive.
So here's why you need the X-ray in Tucson. During the summer months, especially around 4th of July, we have a huge influx of trauma. So I wanted to see how long it would take me to fill one slide worth of fractures, and it only took me two weeks worth. So on average, we were getting 2 major broken animals per day in this time frame. And if you don't know, you have to have these diagnostics, or you have no idea where to start with a lot of these cases. So that said, all of these except for 2, one was cancer and one dog actually died while we were taking x-rays. The rest of them, 27, we fixed with really low-tech, cheap materials. So we either slapped a cast or a splint on them, let them heal in a kennel for a couple of weeks with pain medication, amputated their legs, or did some cheap in-house stuff to fix them up. So you just need to know what it is, and then you can probably fix it pretty cheap.
So as far as treatment of bone fractures, there are a few ways to go. Splinting or slinging to immobilize the fracture is number one. If it's a long bone fracture, there isn't a wound where the bone is actually popping out, causing infection. This is super easy to do. You could put a splint on them, send them to foster, change it every 2 weeks. So 3 splints later, hopefully the dog's leg is healed and they're ready to go. If it is an open fracture where that bone's sticking out, oozing pus, it's just really disgusting. That infection has been there probably for a week or more. They're super painful. Amputation, and they have 3 other good legs. They're getting around great. There's nothing wrong with amputation. We amputate the majority of, the really, really bad fractures. If they've got so much trauma to the limb that, it's mutilated, there's dead tissue, they don't have feeling at the end of their toes, when you're pinching them really hard, that kind of thing. And then we only do expensive surgery on the ones that have multiple limbs that are involved. So, you might have a pelvic fracture with a front leg that's also fractured, then, we'd get the front leg fixed, that kind of thing, just because, they're probably going to be in lifelong pain if you don't. So those are the ones we will actually spend money on. As far as dogs that come in hit by a car, I'm sure you guys see them all the time, we do. Basically, it's getting them again on pain meds, treating them, the first 3 days is the most important. Pain meds, anti-inflammatories, you want to treat them if they're in shock, so if their gums are pale, their pulse is really weak, that kind of thing. We'll get them on IV fluids if needed, and then just reevaluate them daily. It's something where you just get all the treatments on board and let time take its course. Don't sit there and watch them and, get all depressed that they just got hit by a car, because these guys do great, and with time they'll turn around really quickly. They might not eat initially, because they're in shock, but a big dog that doesn't eat for a few days, it's not a huge deal. You obviously want to get them back eating, within a few days, but don't be too concerned if they're not eating right away. As far as the risks and benefits of the fracture options that we just went over, we're going to save more of these guys, because we're not going to be trying to raise money for every fracture that comes in, which could be $1,500 if you're talking about fixing it with a orthopedic surgeon. So it's going to cost less. You can get a splint on these guys, send them home, or amputate the leg, send them home, and they're pretty much done. They never need a treatment again. So decrease transport to and from the clinic and that kind of thing. The downfalls of it, cosmetically, it may heal kind of wonky. We see plenty of fractures that come in, old fractures, and the dog's leg is super just bent in a weird angle, and they're using it and they're non-painful. That's an old fracture that healed without anything. They were probably out in the street on, just loose, and that fracture healed. but it's not causing them pain. It just looks weird, you know? So there's no, just leave that alone, it's fine. If it's a really bad fracture as far as the ends of the bone aren't actually touching each other, so they're off, we call that displaced. You know, it might take a little longer to heal because those bones have to move towards each other and it has to grow together. So instead of 4 to 6 weeks, it might take 6 to 12 weeks. So just, you know, you base it on them. You know, are they less painful? Are they bearing weight? You know, and then once they're fully weight bearing, you know, your vet palpates it, it's stable, they're good to go. And it's important that we note these things in our records because they'll go to their adopted home, their vet there, you know, and then the vet will look up what exactly happened. And if there's no note in there on, oh yeah, fracture was stable on this day, you know, and the patient's bearing full weight, if they go home and then the next day they're not bearing weight and that fracture breaks or something, at least you have the record there that says, no, you know, in our exam it was healing, and so maybe that person let the dog go out to the dog park the day after the splint came off or something. So education is huge, letting the adopters know everything. We give all of our animals that have any kind of in-depth medical condition a medical consult before they go home, just to outline what happened, what the issue was, and basically a prognosis and what to expect for the future so that, you know, they're not surprised. So we're going to go over a few cases. This is little Bug. He was the cutest little thing. He had a broken pelvis and a broken femur. So he was doing great though. Femurs actually heal very well. They don't need a splint. Actually, you shouldn't splint them just because of where they are. So they will heal on their own. So this guy, he had crate rest anyway for his pelvic fracture. And so that allowed the femur to heal as well. And he did great. We didn't need, you know, any kind of surgery on him, just rest and pain meds. Cost around $100. Yeah, we would sling him. So, you know, manufacturers make slings, or you could just use a towel. That's the cheapest option. Sling him out to go to the bathroom. Initially, when they're really bad, you might need to just put some potty pads under him, you know, switch him, change his position so he doesn't get sores until he's less painful. And then, you know, you can start slinging him out. But yeah, in a large dog, it can be an issue. So that's where it's really important to find a foster that knows a strong person that can deal with these guys, because bigger dogs are more of a struggle. Little dogs are great though, you know, they're super easy. This is another case, Elsie. She had pretty severe pelvic fractures, so she had 6 fractures. But even so, she did great. You know, 8 weeks later, she's getting around. And what you'll notice on these guys is around week 4, they'll actually start to get up and move around. They'll be stiff and, you know, still lame, but if the pelvic fractures are healing, which they're gonna heal, I mean, with time, basically take it, just watch them and they'll tell you when it's healed. When they start walking, getting around, great. Once they start running around, you know, you're not letting them do much, but once they're feeling better and they're trying to do more, you know that it's healing and they're less painful and that kind of thing. And we have a slide further on here, but pelvic fractures, a lot of people really are afraid of them. And the thing is, they're so easy. Cage rest and pain meds, 6 to 8 weeks, maybe less if the dog fractured, you know, 2 weeks before you saw them. So very small percentage of them will have issues as far as passing stool through their colon if the fracture has actually closed that pelvic inlet. So those cases, you may need to have them on lifelong Miralax to help the stool be softer. That's very rare though. But, you know, worst case scenario, we really do not fix pelvic fractures at APA, do you? I mean, it's kind of a general rule, unless they have like 4 broken limbs and a broken pelvis, we don't fix it. If they're having trouble passing stool through, we'll just get them on Miralax, and that's something you could buy at the grocery store, you know. This is an example of a chip-in page, kind of like a GoFundMe. I'm sure you guys probably use these. This is how we raise money for pretty much any expensive surgery. If there's expensive blood work for a certain thing that's kind of out of the ordinary, we'll post that. Cute picture, you know, put a little brief summary of what's going on, and then people can see how much money is raised until it's full. And then once that's full, then we'll do the procedure. But we don't just do it, because obviously, you know, where does the money come from? We do have like a little bit of funding that in case we do have a dog that comes in with multiple fractures and they need to be fixed ASAP in order to, you know, have the best prognosis, we can just say, okay, we'll do the surgery this week, and then we'll kind of post another, you know, GoFundMe or something to replenish that.
And actually, can you go back real quick? One thing that we very quickly run out of money to fix a knee on a Chihuahua when they're all bad knees. So I eventually was able to convince our administration at the time to invest in sending me to a training. There are lots of training centers around the US. And in Tucson, fixing a luxating patella costs $3,500 per knee. But for $3,000, you can go and learn how to do it yourself. So they chipped in, trained me, and the setup for those kinds of surgeries is really cheap. You don't need like drills and crazy stuff. So for a couple $100, you can get all of the gear you need. It's not a major implant. You don't need to be a sterile facility. But you can fix a lot of little things like that on your own. And those training courses will teach you knees, basic hips, and other things that you can save a couple thousand per animal and use that money just for the ones that are otherwise not going to make it without the specialty surgery.
And, you know, a lot of vets that are looking to get their skills better, that may have not done the surgery, they may have seen it and they're like, you know, I want to start doing them, that kind of thing. They will want to become involved, so you just kind of got to look around and search and word of mouth and that kind of thing, because a lot of like younger vets who are, you know, right out of school and they've been in the surgery and they're like, I want to start, you know, doing these things. They might be willing to help you out and do them.
Speaking of luxating patellas, our vet has swung the other direction on small breeds and is suggesting not fixing them. Do you have like you only fix grade 3 and above, or how do you decide what luxations you fix for?
Yeah, exactly. If it's bilateral and yeah, they're severe, it basically is debilitating to the dog because, you know, their knees are all wonky and they're hardly even weight bearing, then that's when we would fix them. If it's a intermittent limp no, we wouldn't do it in that time, yeah.
Yeah, we have the same criteria. They have to be painful, lame. They can't be very old. We have a lot of 10-year-old dogs that walk like fruit bats and have their entire lives. So, you know. Absolutely. Anytime you can get an animal into a foster home, go for it. She asked if it's appropriate to put these animals in foster homes while you're fundraising, which is yeah.
And on that point, any animal can go to a foster home if it's stable. So the only time we need it in the clinic is if it's critical. So, you know, it needs IV fluids. It needs something that only the clinic staff can do. We even send some fosters home with IV fluids to people who, you know, are skilled in that sense. So they're better in foster. Really, any dog, if you educate the fosters, they can go home. So this is a case of proptosis of the eyes. This is the dog up top there. I mean, all of them, they probably had those eyes like that for a while. So a lot of people freak out and see that and say, oh my gosh, we need to take the eye out right now. If you can't take it right then and there, you know, pain meds, obviously. If they seem like they're infected, antibiotics, they need to be removed, but, you know, you just do it when you can. It really is just the cost of the medications and then the time of the vet to, you know, take the eye out. So it's not really that expensive at all. We will, if it's, you know, we will try to raise the money for these things. A lot of times we just do them. It's pretty routine for us to do a lot of soft tissue surgeries in-house, so.
Yeah, and at PAC, an enucleation on a dog or a kitten is about a 20-minute procedure. So like for an average relief vet, that's like $25 of hourly vet time. So it's pretty cheap. The problem we find often with these herpes kittens where their cornea ruptures is that they're so ugly. They can't go up for adoption, but they're not of weight to go under surgery. So, they're coming in at a pound, and that's just a little too light for my taste to do an enucleation. So they have to go to foster, and then you have to manage the foster's expectations. These 2 kittens were mine, and ultimately one of the eyes just fell out. And so that can be alarming if you're not expecting it.
So this is a case of some kind of burn, it could be a chemical burn, trauma. So, all the whole back there was burned off. Feet were as well. And these guys, they again do very well with time, bandaging, topicals on those wounds. Mostly it's time though, keeping them clean. Bandage material can be expensive, so this is one that you would want to pitch to marketing. If you have a marketing team, put it out there, because people really, obviously that's sad. So a lot of people will chip in. They'll, put the bandage material on the Amazon wish list, that kind of thing. And you could raise a lot of money for these cases. In this case, like it's noted there, the leg contracted. Basically, the wounds were so severe around that top of that leg in that middle picture that the skin just contracted. Skin will stretch with time, but if it's a thing where it's painful for that dog to use the leg, we might have to amputate it down the line. So some of these cases need, different treatments along the way, and it might take a little while, but they do get better. And this one would be a case, again, that goes to foster, for sure.
Yeah, the case on the far right, if you advance it, the foster learned how to do the bandage changes, and ultimately the dog did great, didn't lose the leg. And there's one more picture of, this is the picture you put on your webpage, though, to get someone to come and foster it, not the picture of the leg. So, but this was a success story, and of course they failed and adopted the dog.
And wounds, just in I've been in shelter medicine for 6 years or so. I never would have thought the wounds that I've seen heal would have healed. It's really amazing. Again, if that dog's quality of life is there, they're on pain medication, they have a loving foster or somebody who's giving them love and attention, these things, just give them time. So, Manuka, this is a case of an older dog. You've probably seen these guys too. They've got arthritis. Heartworm positive, but this is a very sweet dog. Age is not a disease, so we can't hold that against her. So what do? We put her on joint supplements, pain meds, anti-inflammatories, and treat for heartworms. So cost there was $250. Heartworm treatment, and I think we hit on this a little bit in the future, maybe not. But, there's 2 ways to go. If you don't have money, if you can't afford a miticide, that's the expensive route. You could do slow kill. Cardiologists in the veterinary world have said, if you're a shelter, there's no downfall to doing slow kill, which is Heartgard every 2 weeks, plus or minus a doxycycline, which is an antibiotic, intermittently, and you do that until they're negative. Basically, you're preventing the worms from reproducing, so they're not forming any other worms, and so hopefully they're not causing any more trauma being in there. Best thing, would be to kill them fast with the injections. But when you have an older patient that maybe has other disease processes going on, maybe they have kidney issues, you're not really sure that putting them through the imiticide treatment is worth it for the length that they're going to live in that sense, like say a renal failure dog. I'm probably not going to treat that dog with a miticide if they're near the end, like they're showing a decline as far as renal failure goes. I'll just put them on Heartgard and let that run its course. Yeah, as long as you do that low dose, it's like 0.001 per 10 pounds, the super low heart prevention dose. These guys we see occasionally. This is a little Coda, a little Chihuahua with a huge head. He was actually found by a dumpster. I mean, who would do that, you know, this little cute thing. Not really aware, pretty much comatose, couldn't walk around, wobbly, couldn't see, so neurological. And so the primary reasons for this are going to be hydrocephalus, you know, which would be he was born with that. It's just going to run its course. You can give him medications to help prevent the fluid from building up in his brain. That's what hydrocephalus is. And hopefully when you do that, then his symptoms will hopefully go down, so maybe he'll be able to walk around better, he'll be able to see. On the other side of things, if it was head trauma, that's actually a good thing because we could treat that. We can give him IV medications, mannitol, hypertonic saline, that will help decrease the pressure in his head, and then we can get him past that. So you basically have to just start your treatment process. What we would do is treat for everything, so get him on the meds that will help to decrease the fluid production in his brain, you know, get him on the meds for swelling due to trauma, and then give him some time and see what happens, and of course pain meds as well. And you know, these guys, they may only live for 2 weeks, you don't know, so these ones are perfect to send out to foster, and people love these guys, so you'll find a foster pretty quick. But again, you have to educate them about if it is hydrocephalus, you know, they have a shortened lifespan, the meds, you know, may or may not work, and it's inevitably just going to get worse. So you just got to prepare them for that so they're not freaking out when the time comes. And mange. So mange, you know, we see a lot, especially, you know, where there's humidity and that kind of thing. There are 2 different types. You guys probably know, but sarcoptic mange, that is the one that can actually spread to other dogs really easily. They're very itchy. They can get real crusty. So these guys are harder to find foster for. There are a few different treatments for it. The best thing to do if you have the budget to do this is either do a Revolution every 2 weeks, or NexGard. You can give them 1 tablet of NexGard and that treats them. Bravecto as well. So those are the more expensive treatments. If you really don't have, you know, a lot of funds, you could do ivermectin. And that's just once a week. You just give them ivermectin for 6 weeks. We like to consider them non-contagious at the 2-week mark. But basically when they're not itchy anymore, you can pretty much say they're not contagious. And this is controversial. All vets think differently on this. Some vets will be like, go the whole 6 weeks. We go by the 2-week rule, and we'll put them back in the general population, and we've never seen it transmit to the other puppies. So for us, it's experience. The main test to differentiate this from Demodex and other things is the penipidal reflex, where you scratch behind their ear. And if it's sarcops, usually they'll bring their back leg up and have that scratching reflex.
And one of the things to consider in the treatment plan that you choose at PAC, we go for the more expensive single doses because we don't have enough staff to do the more prolonged treatments. So we fess up and do that first.
Now, on the other hand, Demodex, you know, much easier to find foster. These guys can look really horrible, and they get better, I mean, miraculously. You wouldn't even recognize the same dog. It's not contagious. It's more of a stress, immune, you know, issue. So a lot of times all of the puppies in a litter will have it just because they're in bad conditions, malnutrition, that kind of thing. The treatment for this, again, cheap treatment, you could do ivermectin. That's once a day though, so it's once a day for 6 weeks. You definitely need somebody who can be doing that. But otherwise, again, you could do NexGard, Bravecto, they work as well. So like she said, if you have the staff to treat, you can do one thing. If you don't, you could spend a little more and do the, you know, more expensive.
Medication do you use to treat the skin immediately, like the lady who pull skin?
And we're going to go through that. So you have your mild forms of Demodex, you know, that may have a little mild skin infection. This is probably moderate, this picture here. But yeah, we will start a broad spectrum antibiotic. Cephalexin is great, 2 to 4 weeks, depending on what their skin looks like. You know, they'll have that smell. You can use shampoos and stuff if you want, but you know, that takes time and somebody to do that. So you don't need to do that. You also want to deworm these guys because if they have Demodex, they probably have some other systemic thing going on. So probably just throw all the dewormers at them just to be safe. With these guys, we'll adopt them as is and send them with the treatment. So we'll do our initial treatment. Hopefully, if it's like NexGard or Bravecto, it's taken care of, and then we just send them with some antibiotics, and then they just recheck at their vet. Severe Demodex, so there is a severe type, and we don't see it a lot. I saw it a lot down in San Antonio. You guys might see it down in Palm Valley. Their legs swell. They get edema, pitting edema, where you could like push into the skin, and it's like a, you know, dough. And this is because they've had the infection, the Demodex, for so long that they start to ooze protein out of their skin, and so they lose protein. That goes down in their system, and then the fluids comes out via osmotic factors. So the way to know this is if you have a centrifuge, you know, you can do a PCV-TP, spin down some blood, look at it in a refractometer. You can pretty much diagnose that, you know, their protein will be under 3 or so, it'll be low. They may also be anemic because they've been bleeding from the scabs due to that and possibly have other parasites. So you gotta treat for that too. If you have the capability of doing a whole blood transfusion, that's great, that'll replace both. If not, another easy thing to do is replace the protein with head of starch, and that just kind of immediately helps the protein in the system increase. It's not gonna produce protein or anything, it just helps their system, the pressures and that kind of thing. So what you do is you get that treatment on board initially, make sure they're eating, force feed them if needed. The food is going to help increase their proteins, you know, within the system, and then once they're eating great and that protein starts rising, then you stop the head of starch. And then as far as continuing to treat it, you know, again, these guys, they'll be on antibiotics as well until their skin's looking better. Doesn't mean that they have to be on 8 weeks of antibiotics, probably just 2 or 4. If they're crusty, bleeding, they're probably painful, so you want to get them on a pain medication. You know, you may want to put like an ointment on them, like silver sulfadiazine or something, if they're actual kind of wounds from this as well. So did that answer your questions? Okay. And then this is a dog with Demodex, Honey, and so she had, you know, a secondary skin infection. We treated her like we were just going over. She actually got ivermectin, so she got the low-cost treatment with antibiotics, and she's looking great down at the bottom.
So ringworm is something that I think, how many of you live in areas where you have a big pulse of seasonal ringworm? Everybody. Yeah. So don't be afraid of it. It's so cheap to treat. So make sure that you're using the cheapest things you got. I know a lot of folks are hoping to use accelerated hydrogen peroxide. We still use terbinafine because it's so cheap and there is so much more data that shows its efficacy. And we still use the stinkiest Leyden sulfur dip stuff. But costs, if you're treating one pup, it's maybe $7 for a whole month of treatment that'll be curative. It's even less if you've got a litter and they can all share the same dip water. So ringworm is super satisfying to treat. When we see it in older dogs in Tucson, we're worried often often about some other underlying medical condition. But if they're puppies, just go ahead and slam them with this, and we have great turnaround. So parvo is, how many folks are treating parvo? Great. We love it. We've only been treating it for about 2 years now, and between Austin Pets Alive and PAC, we have a really fantastic success rate. There is going to be this link. Austin Pets Alive has a handbook for parvo. A lot of people, there are lots of variations on how you can do it, but if you haven't started, don't reinvent the wheel. Go check that out. Maddie's Funds offers internships to come in to hang out in Austin and see how they run their facility. We do things slightly differently. Again, we don't have the staffing that some places do, so we have a very quick and dirty protocol. We use the Colorado outpatient protocol. It runs about $26 per pup. We use vet student labor, or vet tech student labor, and that saves us a good amount of money. APA, their costs for pharmaceuticals are about the same, but they're lucky enough to have staff. So just keep in mind that you can get away with some pretty cheap treatments and have really spectacular survivorship.
And let me just mention, 3 years ago, we didn't have actual paid staff back there. So this has been, just over the years, we've just gotten bigger. But we started low with volunteers. So switching gears a little bit, I hope everyone in the room is treating for upper respiratory infection. Yeah? Is there anybody that's not, that's euthanizing for it? Okay, well, take a picture of this. Doxycycline is very inexpensive right now. We've seen that fluctuate over the years, but even for a 50-pound blockhead, it's only $3.50 for 1 week. And right now, we just got a new facility, and our rates of significant respiratory disease have plummeted. So we only have to have these guys in isolation for a week, and they can go back up for adoption, but they're not even clinical after a few days. So we're in a really great place, but Doxy is really cheap right now. Make sure you have a lot of it if you're gonna start trying to save more. So one thing I'm gonna try to reflect on, going back to the talk from yesterday, go ahead in the next. So as you're starting to save more, as you're trying to do more intensive medical, please be very vigilant of the population size at your facility, because as you add more animals, there's going to be a lag in terms of who's going to be coming in to adopt them potentially. So make sure you get your foster program up and kicking. And distemper is something that may eventually crawl in if your population census gets too high, your animals are getting too stressed. So always be vigilant for that upper respiratory to take a turn and maybe become distemper. In Tucson, we have a huge problem with it. Austin sees a ton of it. But there is another talk at 4:15 that Ellen Jefferson's going to lead. So please go there, because distemper is not a death sentence. You can get 80% survivorship with adults, but it takes time and it takes advanced pharmaceuticals. So. Yeah, and it's just super important. This is why to vaccinate everybody, immediately. Best bet is before they get onto the shelter campus. Because that vaccine is what's going to actually save them. It might not totally prevent them from getting distemper, but it may help the severity of it, so they may not get to the full-blown neurological distemper.
Yeah, so this is just going back on these points that if animals can, by any means, get vaccinated and have 3 days before they hit the general shelter population, that may be the difference between them dying of distemper versus them not contracting it or getting a mild case. So your hygiene at your shelter needs to be even better if you're going to be launching a medical program where you're saving more animals and potentially increasing your census. So please be very vigilant of that. Because it happens pretty quickly that the numbers creep up. So we can go ahead and skip this since we're out of time. Distemper treatment, they're going to go over at length. One thing that we have calculated in the multiple outbreaks that I've seen at my shelter is that it's expensive to treat. It's about $120 per animal just in medications. We have great success rates getting adults through it, but it's something you have to commit to, so it's way better to avoid it happening. If you are in a situation where you've got an outbreak, not all outbreaks are going to be as expensive as others. If you're in a facility like we have Strepso come in every couple of years, and we're now at the point where we just throw doxy at the entire population for 14 days. And in a recent case where we had an outbreak last summer, it cost us about $2,100 to save 350 dogs. So we didn't even stop operations. We just sent them home with doxy and business as usual. We separated exposed from unexposed, but we had a perfect survivorship except for the one sentinel animal that we found deceased. So if you're going to invest anything into your medical campaign before you start pricing fentanyl patches, make sure that you're taking care of business with your biosecurity and your fomite control.
Now, just to touch on GI parasites, you know, these little unthrifty puppies most likely have parasites. We get a lot of puppies that the previous shelter thinks that they have parvo, but they're parvo negative. I mean, it could be early stages, true, but a lot of times it's just parasites. So we'll put them in an area that they can be isolated in case they do break with parvo, but not put them in a parvo ward. And we'll treat them with dewormers. And usually within 3 days, they're back to normal. They're eating, drinking, they're pooping fine. So these guys actually have rectal prolapses, as you can see the little red tissue hanging. So they were severe cases, probably had diarrhea for a while, and that, you know, over pushing of their colon made it pop out. So there are just some pricing on the dewormers. It's really not that expensive. The most expensive thing really is the Panazaril. Yesterday we were talking, and there are some other options. That is a horse dewormer, and it can be hard to get if you don't have a vet that can get it. So if you look, there are some like overseas options. There's, I think in Australia, they have a different version of that you can get that somebody mentioned. Yeah, I didn't even know that. So, you know, search for it if you don't have a vet that can get it, or get a vet that can get it. Kaolin helps just firm the stool up if they have really bad diarrhea to the point you think they're getting super dehydrated. You want to just have immediate response until the dewormers start working. That could make them constipated though, so you want to make sure to monitor, and once the stool firms, back down on the kaolin. And then, you know, you can always try yogurt for the probiotic effects, bland diet, chicken and rice to help in the meantime. Make sure you're keeping their hydration well. If they've had diarrhea, you know, for more than a few days and they're a little puppy, that can be deathly for them, so you want to make sure to replenish that. Give them sub-Q fluids. If they're vomiting, you want to make sure to give them something to prevent that as well, because a vomiting puppy can go downhill really fast. And then, again, you can always retest them, you know, consecutive days if you really need to know for isolation purposes and that kind of thing. But if they just have diarrhea, but they're still eating and doing well, most likely it's probably not parvo. So these are the ones we kind of know. You know, they're still pretty energetic, they're puppies, they're still eating, but they just have crazy diarrhea. Usually it's parasites, usually. Yeah, if they're still having crazy watery diarrhea, you know, in 24 hours, or they're going downhill, they're starting to vomit, you know, they're starting to have a decrease in appetite or that kind of thing, then you'll definitely want a parvo test and just become more aggressive with your fluid treatment and your sub-Q treatment, something to keep them from vomiting, whatnot. Heartworms, we see a lot here. Dr. Wilcox doesn't, so it's just depending on where you live. We see a ton. We had an estimate of about 500 this last year. That's gone up, I mean, like doubled since, you know, 3 to 5 years ago or whatnot. So it's a large portion of our intake. We treat it. We do the fascicle treatment with the imidacide. We just increase their adoption fee to help cover that. Depending on the size of the dog, it can take $50 to $250 to treat. Again, going back into slow kill, if it's a medical condition that's making the animal, you know, a worse prognostic indicator per se, because they have something else going on, or maybe they have really severe heart disease from the infection, then we'll elevate that to look into it more, like more diagnostics like x-ray, maybe an echocardiogram, but we really don't do that for any any of these guys because it's so costly unless they're clinically not well. And it's going to determine, should we do the fast kill or should we continue slow kill, that kind of thing. Okay.
So in Tucson, we do a lot of recycling of animals. So we get a lot of aged animals turned into our shelter as euthanasia requests that have never seen a veterinarian. And we save at least 25% of those. And we have lots of animals that just walk in with tumors hanging off of them and dental disease. There's almost no small dog that's too old for adoption in Tucson. We just have to fix it up first. So we spend a ton of time cutting off tumors and doing dental work. Go ahead. The prices on these kinds of fix-ups vary depending on how fast you are at cutting off tumors and taking out teeth. We don't do root canals. We just take out all the teeth that move. It's awesome if you have a mouth that bad on the right-hand side because they're just floating in pus. That's actually like the fastest dental on earth. Really fun. The tumor on the bottom took me an hour to take off, but it was massive, and everyone was really rooting for the dogs, so we went ahead and tried it. That said, every one of these cases is individual. Before I put the time into that tumor, I did run blood work, I did do x-rays, and I am going to submit that tumor for histopath. For the extra $70, we'll know if it should be a hospice case or if it can go up for adoption. So, and then I think there's one more picture. Like, look at that little dog. It doesn't even smell anymore. It's really cute.
And that dog at the top left has 3 testicles.
He does. It was a real quick surgery for me. I'm a high volume surgeon too. So one other thing that APA or Austin has been working on for many years, and we're just barely starting, but there are cases where an animal's not adoptable, but it's not quite ready to go either. And these are renal cats. These are dogs with terrific heart murmurs. And maybe there are places for them to go. I've been shocked since we started this in the past year how many people want to do hospice fostering exclusively, so hospice foster. APA and PAC are in agreement, and the only thing that we provide for care is pain medication. So these animals are often, sometimes you can't predict, they may live a year or more on just that. It's difficult for us to know the precise histories. Most of these animals have never had any care. But one thing that's also really crucial is that you always have the ability to perform humane euthanasia when they're ready. And usually the fosters are extremely appreciative if you allow them to be present for it. So one thing I was thinking about, while we were talking about this, is that this is actually really hugely rewarding for your staff that is otherwise on the fence about whether or not it's appropriate for us to euthanize an old dog with dental disease just because it has a heart murmur. So this allows those gray cases to go somewhere until we can figure out really what's most appropriate for them.
And this is just a case of an older guy, cute little dachshund. He had multiple things going on: Cushing's disease, heart disease, dental disease, skin masses. So he was a hospice case. Basically just education of your foster to know what's going on, that we're just gonna let him live until he's not feeling well anymore, pain meds, that kind of thing. So finally, if you're going to launch medical, you better have a plan for all of the increased hands that you're going to need to make this stuff happen. So fosters are like everything. You have to get a good foster program going, and these people are all trainable. Even if they've never held a needle before, they're going to very quickly learn how to do sub-Q fluids, bandage changes, all of the physical therapy. They're going to be great at it, and they're going to love it. The other thing is in PAC, we have a lot of volunteers that work in the medical area specifically. They do our surgical instruments like you guys do, but we also have people that try to do enrichment for the dogs that are otherwise lying in their kennels. They'll sling walk them outside with the pelvic fractures. They tell us everything about their defecation and every morsel of food that they eat or don't eat. And we have some volunteers that come in and just massage them, and especially for the cats, that's the only nice handling they may get. So it's important to let people know you're saving animals and that you need help to keep their spirits up, because otherwise we're just poking them all day with medications. And lastly, I think everyone has heard this in every talk, don't forget to tell your success stories.
And even if you're not successful, but we have had enormous amounts of medical donations made. Austin gets them made in the general fund. They need that desperately. We need it more intensively in the medical part of our program. So when we tell a medical story, we have a means for it to be funneled to medical. And so for the cases where the dog was found hanging from a tree or shot a couple dozen times at close range or born without legs, these animals, by saving them, have generated huge amounts of revenue for our medical programs so we can treat more parvo, save distemper dogs, that kind of thing. So the better the story, the more you can save as a result. So I think there's one more that says, same thing, snake bite. Good before and after pictures, and then don't always remember to thank people for their donations.